What is borderline personality disorder, BPD? Borderline personality disorder, BPD, is a mental health condition characterized by intense and unstable emotions, self-image, and behavior. It affects approximately 1 to 2% of the general population, and it is more common in women than men. Individuals with BPD often have difficulty regulating their emotions, and they may engage in impulsive and self-destructive behaviors. BPD can have a significant impact on a person's relationships, work, and overall quality of life. Symptoms of borderline personality disorder. The symptoms of BPD can vary from person to person and can be challenging to diagnose. Some of the most common symptoms of BPD include intense and unstable emotions. People with BPD experience intense and unstable emotions, including anger, anxiety, and depression. They may have difficulty regulating their emotions, and their moods can change rapidly and unpredictably. Impulsive behavior. People with BPD may engage in impulsive and risky behaviors, such as substance abuse, binge eating, reckless driving, or unprotected sex. These behaviors can have severe consequences, including legal and health problems. Self-harm. Individuals with BPD may engage in self-harm behaviors, such as cutting, burning, or hitting themselves. These behaviors are often used as a coping mechanism for emotional distress. Fear of abandonment. People with BPD often have a pervasive fear of abandonment. They may go to great lengths to avoid real or imagined rejection or abandonment, including clinging to relationships that are harmful or not fulfilling. Unstable relationships. Individuals with BPD often have unstable and intense relationships. They may idealize someone one moment and then suddenly devalue and reject them the next. Distorted self-image. People with BPD often have a distorted sense of self-image. They may experience frequent changes in their sense of identity or struggle with feelings of emptiness or meaninglessness. Causes of borderline personality disorder. The causes of BPD are not fully understood, but it is likely a combination of genetic, environmental, and neurological factors. Some of the possible causes of BPD include genetics. Research suggests that BPD may be partially inherited. People with a family history of BPD or other mental health conditions may be at a higher risk of developing the disorder. Childhood trauma. Childhood trauma, such as neglect, abuse, or abandonment, may increase the risk of developing BPD. Traumatic experiences can also contribute to the emotional dysregulation and instability seen in BPD. Neurological factors. Research suggests that people with BPD may have differences in the structure and function of their brains. For example, they may have smaller amygdalae, the part of the brain that regulates emotions. Treatment for borderline personality disorder. Treatment for BPD often involves a combination of medication and psychotherapy. Some of the most effective treatments for BPD include dialectical behavior therapy. DBT is a type of cognitive behavioral therapy that helps individuals with BPD learn new coping skills and strategies for managing their emotions and behaviors. Medication, antidepressant, antipsychotic, and mood-stabilizing medications can be helpful in reducing the symptoms of BPD, including depression, anxiety, and impulsivity. Schema therapy. Schema therapy helps individuals identify and change deeply ingrained patterns of behavior and thought that contribute to BPD symptoms. Group therapy. Group therapy can be an effective treatment for BPD, providing a supportive and validating environment where individuals can practice new skills and receive feedback from others with similar experiences. Mindfulness-based therapies. Mindfulness-based therapies, such as mindfulness-based cognitive therapy, MBCT, and mindfulness-based stress reduction, MBSR, can help individuals with BPD develop greater awareness and acceptance of their emotions, thoughts, and behaviors. It's important to note that recovery from BPD is possible, but it may take time and require ongoing treatment and support. With the right treatment and support, individuals with BPD can learn to manage their symptoms and improve their quality of life. Challenges and stigma surrounding BPD. Despite the high prevalence of BPD, there are still many challenges and stigmas surrounding the condition. People with BPD may face discrimination and negative stereotypes, such as being labeled as manipulative, attention-seeking, or difficult to treat. Moreover, due to the intensity and complexity of BPD symptoms, healthcare professionals may find it challenging to diagnose and treat the condition effectively. This can lead to misdiagnosis, delayed treatment, or inadequate care. To combat the stigma and improve the quality of care for individuals with BPD, it's essential to increase awareness and education about the condition. This includes providing training and resources for healthcare professionals, promoting accurate portrayals of BPD in the media, and supporting advocacy efforts for individuals with BPD. In conclusion, borderline personality disorder is a complex and challenging mental health condition that affects many people worldwide. It's characterized by intense and unstable emotions, impulsive behavior, and difficulties with self-image and relationships. While the causes of BPD are not fully understood, effective treatments, including psychotherapy and medication, are available to help individuals manage their symptoms and improve their quality of life. Reducing the stigma and increasing awareness about BPD is essential to promote early diagnosis and effective treatment. With the right support and resources, individuals with BPD can achieve recovery and lead fulfilling lives.